Hello, everyone. It's right at 12 o'clock Central Time. My name is Larissa DeLuna with the American Heart Association, and I thank you for joining us for today's webinar. Today we're going to cover Marketing Your Get With the Guidelines Award. For a full list of all events and all webinars that we have going on, feel free to visit heart.org/SWA Quality. Before we get started, I'd like to go over a few housekeeping items. To avoid background noise, all lines have been placed on mute. To ask questions, you can type in the Q&A section of WebEx or unmute your line with *6. Also, as a reminder, a copy of the slides and a recording of today's webinar will be sent to all attendees within 1 week of today's event. At this time, I'm going to go ahead and turn it over to Cherie Boxberger. Cherie is the Regional Vice President of Quality and Systems Improvement for the Southwest affiliate of the American Heart Association. Cherie?
Hello, everyone, and welcome to our webinar. And Larissa talked about asking questions, and certainly you can ask questions in the Q&A section of WebEx, but today we'd also like you to share your ideas of how you have promoted your awards. So this is the perfect time of the year. I know we were waiting and waiting to get the awards out, but now you have them in your hand, and this is the perfect time for you to promote your American Heart Association Quality Awards. So let's see here, Larissa. Am I controlling here? Let me see.
Should be.
So a little technical.
I think you got it. Yep,
you're
moving.
Okay. I'm moving? Oh, mine is not. What am I on? Here, I'm still got the main screen. All right, well, let's see, was that the first slide? Okay, all righty. So what we're going to talk about, just to give you a little bit of an idea, is we're going to look at some of our programs because I want you to know what other programs are available. We actually have some new ambulatory programs that you may not be familiar with, so I'll just show you real briefly what we have because there are quite a few ways you can be recognized through the American Heart Association. We'll real briefly look at the guidelines for promotion. As you can imagine, when you're working with branding, there's a few guidelines you need to follow, but they're not complicated, and we're here to help you with those. You should have received an award toolkit, and Larissa will talk a little more about that, and we want to show you how to use each part of that. And then we want to show you lots and lots of examples of how you can get busy sharing your Get With the Guideline or Mission Lifeline award. So we'll see if this forwards. Here we go. Why in the world do you want to promote anyway? I know we didn't go into healthcare so that we could get plaques and awards and so forth. That wasn't the impetus for us going into this field. But the fact is there's really not a lot of opportunity for celebrating in the healthcare world. And so we want to take those opportunities and really maximize them. So certainly a good reason to promote your recognition is to acknowledge the work of the entire multidisciplinary team. I have found it to be really rewarding to invite those registration folks and all the people who touch your patients through the course of their stay at the hospital or while they're after they've been picked up by the ambulance and are being treated, to really recognize the people behind the scenes. So it gives you the opportunity to recognize the entire team. Certainly, it's a great opportunity to influence referring organizations to continue to use your services, whether that be hospitals who are using you for referrals, or whether it be referring hospitals to receiving hospitals, or EMS agencies. It's an opportunity to demonstrate, in some cases, a competitive advantage in your community, and also to emphasize the importance of providing guideline-directed care, because I know we're all in favor of making sure that where you live doesn't determine if you live. And, of course, to associate your organization's brand with the American Heart Association brand. A little about that, I've kind of got a delay between slides. Oh, here we go, is that there's a good reason you may want to tie those brands together. And the first one is that there's over 500 million followers that connect through the 89 national and 600 affiliate social communities. So in this day and age where online, internet, Instagram, Twitter, Facebook, LinkedIn, over 5 million followers. So it's a good place to connect in. And certainly an important one is that last one there, that 76% of consumers like or love the brand of the American Heart Association. And not a small percentage that 90% of consumers recognize the American Heart Association brand. So while there may be other brands of quality out there, there's really very few brands that would rival American Heart Association in terms of demonstrating quality and trust. So you want to promote your awards. And I think, just to give you an idea of the different programs, because some of you may be on with your EMS agencies, we do have joining us today both hospital and EMS customers. And hopefully next year we'll also have our ambulatory partners, because we have several programs in the physician offices that we're working on. But right now with the Get With the Guidelines programs, we have modules in stroke, heart failure, resuscitation or code blue, atrial fibrillation, coronary artery disease, and of course our well-known national programs of Mission Lifeline, which looks at systems of care, both with STEMI and with stroke, target heart failure and target stroke. So we have a wide variety of opportunities for you to be recognized. And when you think about what kind of awards you can get, and these are highlighted, the ones that are highlighted are actually complimentary. Of course, there has to be some data submitted, but the Mission Lifeline EMS and the physician practice programs called Target Blood Pressure and Check Change Control Cholesterol actually are available at no charge to those institutions. And then we have a good number of in-hospital opportunities for recognition, all the way from referring hospitals to receiving hospitals. You know, we started our initial work with STEMI, and of course then that transition to guideline-directed care for the in-STEMI patient. And then we talked about those in-hospital quality opportunities. So let me turn it over to Larissa. She'll talk a little bit about the bones of what you hopefully received, and if you haven't, how to get it. And Larissa, I'll hand it over to you.
Great. Well, thank you everyone for joining us. We're excited that everyone's interested in learning how to promote their award within their community. So one of the first things I'm going to talk about is that you should have received this congratulatory email from the American Heart Association, in that there were links to the appropriate award kit for their award that you received. This email was sent about probably 2 to 3 weeks ago, so check your inboxes if you haven't received that. It would have had, again, the link to the marketing kit that's going to have all the resources we'll talk about today, and your actual award certificate would have been attached in there also. So once you get this link, if you haven't received it at all for some reason, there's an email address on here, swaquality@heart.org. You can email us there and we can make sure to get you a copy of this email if for some reason you haven't received it. So the link in this email will take you to a page that looks similar to the one that's on the screen. From here, you'll want to confirm the award name matches the same award that you received. And just as a reminder, the recognition for these awards is based on your 2018 data. Included in your award link are tools to help make promoting your award simple. But before we jump into different ways that people have promoted the award, we want to go into kind of some of the rules and regulations and take a quick look at our promotional guide. So it's really important that this promotional guide is shared with marketing, communications, and public relations partners within your organizations. They'll understand a lot of the rules and regulations in here. And also with EMS agencies, we realize that sometimes you might not have the same support as the hospital when it comes to marketing, communications, and public relations staff. So feel free to get advice from your QI director on how you can promote your award if you have any questions. So once you click within the body of this email to the link, you're going to look at our promotional guide. So this is kind of the table of contents of what's covered in there. It's going to really take you through a whole guide and plan of how to promote your award. One of the most important things that you'll want to do when talking about your award is really understand and be able to explain the type of award you received. So you can see here we have an explanation of the Get With the Guidelines and Mission Lifeline Awards for you. This is really important when you're talking to the news media, your internal partners, your C-suite level people within your hospitals. You're probably, if you're an EMS agency, talking to your county officials, your city officials. You'll want to really understand the specifics of your award and be able to articulate that. This goes into a little bit more about the explaining those actual recognition levels that you received. So you can see we break down bronze, silver, silver plus, gold, and gold plus. So you have the information on how to articulate those specific levels, the time frames and the percentage of adherence to measures that you need to accomplish for all of these different levels of awards. One of the things that we do want to make sure to cover is how you use the branding and logo of the American Heart Association's logo. So there's a few rules that you'll want to keep in mind when using this. Just so you know, you're not able to use the heart and torch in any way, and you can't use the American Heart Association, American Stroke Association name in text without pre-approval, and I'll cover what it takes in the steps for pre-approval in a second. But just remember that everything that you have and those links that are provided in that email have already been pre-approved. So really it's only if you're getting creative and creating something from scratch that you'll want to get pre-approval on anything. So everything that's already in that marketing toolkit for you is free and ready to use. Another thing we want to cover, is the guide on how to use your award logo. So it's really important to make sure to read the specific guidelines on how your award logo is used in relation to other graphics. Most of your marketing people are going to know how to talk with the height, the width, bleeds, no bleeds, things like that. So you'll want to make sure specifically to talk to them and bring them into the process if you're planning on putting the logo on anything. We also want to cover what to say and what not to say as you're promoting and creating messaging around your award. So here are some examples of some great things that are approved and some great sample messages and some language to avoid. So for the most part, language to avoid, I'll just go over a few examples that are really important. You want to refrain from using any terms that imply superiority or being the best or better or the only. You want to make sure to stay away from those terms. Also using terms like the first, you're the first one in your city or in your county to get this. You want to make sure that that's validated through the approval process before you're talking in any of those specific terms, or something like the only hospital. That's not appropriate to use either. If you're, again, creating anything from scratch and changing the language and things that have been already provided for you in those templates, please go through our process of getting it reviewed before publishing anything. And this is a little outline of what you will need to do if you develop and need that approval process for any additional promotional materials. So you'll want to make sure to give us a minimum of 10 business days in order to approve anything that you're creating from scratch. And you'll see there's an email address to send your specific materials to. That goes to our national office, and our national marketing department reviews them to make sure that they are in line with all of our criteria for promotional materials. So I'm going to go ahead and turn it back over to Cherie, and Cherie's going to go over the fun part of what you can do, since I've already covered all the rules and regulations. So Cherie?
Wasn't that mean of me to have Larissa do all the stuff you can't do, and now I'm going to show you the fun things. But really the rules are not significant, and they're important, but they're not hugely difficult to do. And if you send us something with a creative idea and you're doing a banner or you're doing some of the ideas that I'm showing you, then we will work with you to make it work for that. You notice when it was talking about regional that you might be the first Gold Plus in, you can't say North Texas. You have to say in Irving, in the 3-county area. You have to be very specific as it relates to what you've achieved. But we'll help you look that up and confirm it, and you can use some of that. So let's see here if I can move the slides.
I can do it for you, Cherie. Just let me know which one you want.
All right. Sorry, it's just not. I'm going to recognition icon. So am I on the one that has that? I'm not seeing. There we are. So, yeah, so this is a really important one. This is probably the one you're going to use the most. and you're going to look at your recognition icons. Go ahead and move it ahead. Your icons actually come in 3 different formats, and I'm sure you're all familiar with JPEG. That's how our pictures show up on our phone. Those are treated like pictures, and they're a little bit bigger. They take up a little more space, but any place where you're going to put a picture in, you can use your JPEG version of your award. Now, we also provide a PNG version, and that's a little smaller in terms of how much space it takes up, and it works perfectly for online work, for creating something where you're not going to post a picture, you're actually going to put a piece of art in the PNG form. And then many of us on the phone are clinicians, and I remember learning this 20 years ago when people are like, I need a high-resolution logo. Well, it's the EPS version you have. But I'll just warn you, you cannot open an EPS version unless you have the right kind of software. So this is the icon that you will send. Your marketing department might request it, or you can just send them the link. Or someone might request it if they're creating a cup with the logo on it, or you're having something professionally printed like a banner or some sort of a decal to put up on the wall. So you've got these icons. These icons, next page, can be used for many, 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 many ways, and I'd actually be interested in seeing what you have done. This is an example. This happens to be in a Houston hospital where they've combined promoting their comprehensive stroke center along with their American Heart Association Quality Award. And so they've actually put it into their elevator. It's going to drive me crazy. I'm still trying to figure out if I can. Oh, did you do that or did I? Okay. Another great idea is to have the icon made into a sticker. Nowadays, you can get stickers of all sizes, all the way up to great big. And if you will have a sticker created, you can actually add it to your tablecloth along with your logo, so whenever you're at health fairs, and then you can actually peel it off at the end of the year and put your new award on there. So using your icon and having it made into a way that you can add it to things, you can have it on the exterior of your building, you can have it on the door, certainly checking with all of your hospital and agency rules before doing anything with the stickers, but it's a great opportunity for you to promote your award all year long. And you can promote this award all the way to next year when the new awards come out. So you still do have an annual opportunity to promote. Next slide. Also, you can make posters. This happens to be, at the time, this was the CEO of Christus Spawn in Corpus Christi, and they had these award posters framed and all around their facility showing that they were a gold target stroke recipient. So it's a good opportunity, and you'll see that we even have some of these ads already made for you. You just have to send them out. Next slide. You can also make banners, and here's an example of a great big banner. They, again, combined their certification along with their recognition from the American Heart Association with a great big banner and the opportunity to show everyone who comes into their organization their achievement. Next. Another example as it relates to messaging. This is an example where somebody used their own, wording. This would need to be approved through the QI approval process. Next. And I think I have an EMS example where and they actually didn't do their recognition. They used a little different part of it. And so that would also be, you could use something like this, but you would want to contact us first for what you're doing, since this doesn't have an award icon on it. So use those icons, pull them down. I thought I had an example where there was one on some. You can also use those to put on your signature, and I may have that later in the presentation. Now you have, oh, I didn't get a circle right, but news release. Now, don't just pass this off. If you're a clinical person, you're like, why would I need a news release? Everyone can use a news release, and you can even just use the center of this and not put it in this newsy format, or this is the format that a news organization, TV, radio, newspaper, would expect to receive a release about your award. Certainly, if you have a PR department, they will probably take care of this for you, but you can do a little bit of background work to make it easy on your public relations, communications, marketing team. This is an example of how it comes. It's already written. It's got all the appropriate wording. If all you do is put your city, date, and hospital name and your contact name, no need to contact us. It doesn't have to be approved. It looks like I can do it now. I've got my little thing. Aha. Oops, I went too fast. Sorry about that. However, it also, you can see here in red that is a quote from our national chairperson of Get With the Guidelines, Lee Schwam, and so there is a comment there. However, you may want to, as you can see above, have your own hospital spokesperson. You could also have your neurology. This happens to be, I think this actually is an AFib example, but you could have your cardiologist who works with AFib be able to give their own quote. Now, if you do have your own quote, go ahead and have us take a peek at that if you're going to change out the quote, but we can do that in a pretty efficient manner. And then there's an opportunity on a press release, and don't be afraid to use these even if you're not a PR expert. You can put there about your agency, and you can have a little description of your agency or hospital. You know, this is a 125-bed hospital, blah, 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 run by the Sisters of so on and so forth. So you can put your little blurb, your little hospital or agency boilerplate there. This is AFib, so it happens to be a hospital example. Now, if you are not going to send something to the newspaper or not going to send something to media, you can still use this and be able to use this same wording in your newsletters and in other things that you're using. And it's all written out for you. You don't have to worry about it, and you can easily get it out the door. Now, if you have questions on this or you don't have PR support, American Heart Association is glad to assist you in doing that. Now, we do not put out press releases from American Heart Association for individual hospitals. However, if you're working in a system of care and you want to have a regional or a statewide press release, that is something we can do because it doesn't show it doesn't show an individual hospital or agency preference. Here, I think I talked about these. Add your own physician champion, add a survivor. Very important, add a photo of your award ceremony or of a survivor. If you have a place that has a small newspaper, my hometown, Mineola, Kansas, has a county newspaper. If I submit an article there, they'll run it in its entirety, and especially if it already has a photo. So take advantage of any smaller newspapers that you have. And then I want to show you the statewide release that we did for the state of Arkansas, because in the state of Arkansas, we actually had 24 hospitals and 8 EMS agencies who were recognized during a luncheon. So we put together a press release for a state or region. So that is something that you can talk to your director of quality about. Now, as I'm zooming along, if you have questions on any of this, please type it in the Q&A, or if you're bold, *6 and come off mute. We'd love to hear from you. Also, if you've used some of these or done some of these ideas, or you have a completely different idea, please type that in and we will share that with our participants. All right, print advertisements. So when you saw the poster that Krista Spahn used in their wall, they actually used one of our provided pieces, an actual ad that's been provided. And it actually has a place for this happens to be an EMS one, and it has a place for them to add the agency logo. So this is something that an EMS agency can use from just how it is and be able to print off the posters or flyers or maybe take them to health fairs so that your community knows that you've reached this level of recognition. There's also, and of course these are specific to which award you got. This is an example of a hospital ad that a hospital can put out. Again, there's a place there to put the hospital logo, a description of what this is. And so this is a great opportunity to make those posters, put them in those frames, and have them around your facility. And then you may have creatives. Of course, many of you might have support from a designer, and your designers can create ads with these, but again, if they're using our, we call this heart and torch, the little, well, I guess it's a heart and torch, you know what it is. And if you're using that separate or you're writing out American Heart Association, American Stroke Association, we need to just take a peek at it and make sure that it's in compliance, but we can turn that around pretty quickly. Oops. Still fighting the little arrows. Oh, here's another one. The right approach. This is another example. Now, this is in a different format. This is in a format that's perfect for online. So if you're going to put something, and we'll talk about social media, if you're going to put something on LinkedIn, this is the kind of ad you'll want to use, not that ad that's for printing. So when you click on that, you'll see digital and you'll see poster for printing. And this happens to be a digital example that's really ready for you to use it on your website or create a LinkedIn post or be able to use it online. And you can see that's a little bit different in terms of it's got the black below, and if you have a light colored hospital logo, that may work better as well. So these are there and already created. You can get one of these going and put it on your website in no time. All righty, well, let's start talking with some of the areas as it relates to internal communication. So here's some ideas, and in fact, this is the one where I saw it put the logo at the bottom. Table tents are very easy to do. You have your icons. There's actually within Word a template for a table tent. It's probably something you might even be able to have printed internally or take it over to FedEx or your local printing area. But certainly table tents anywhere around your facility. Those signs you could use you could frame them like we just talked about, or post the ads in the individual stall walls. No opinions quoted about the promoting in the bathroom. Hang a banner. We saw some examples of that. I love placing a small ad or a sticker on the daily patient menu, just showing that their hospital has been recognized. If you do have a closed circuit television program or like a rotating announcements, making sure you've got on that. I believe I was at the Medical Center of Aurora, where at their coffee shop they had their various quality award winners listed on there, and it was going through. Certainly an ad or an article in your hospital newsletter, and it's important to send a memo to your hospital board of directors, CEO, and other hospital stakeholders. Your leadership can direct you as it relates to that. And then add the award icon to your signature if that's within your, if you're within the rules of your organization. And here's our partner, Jerry, who has added their Get With the Guidelines Heart Failure Award to her signature so that if she sends that out, everyone can see that she's been recognized. Recognition ceremonies are something that we do a ton of, and you might think that that's just, you see everybody lined up with their award, but I really do encourage you to do this. It's a great opportunity to not only include your physicians as well as your other clinical staff, as well as the allied health and administrative staff that help you meet the needs of your patients. And so it is a good opportunity. It can be done in a variety of settings, everything from just having a quick announcement in the hospital foyer to actually tying it in with your board meetings or with a town hall where all of your employees are coming, at just a stroke committee meeting. Also the opportunity to do it at a community event as well. This picture is one of my partners in the Midwest affiliate where they actually had a stroke survivor event. So it was actually a community event focusing on some folks who were victors over stroke, and they actually gave their award at that same activity. So you can be really clever in terms of where you give out these awards. Some ideas is to go ahead and schedule it. You may, you want to talk to your director of quality to get this on their schedule. I will tell you that most of our directors have 50, 60, 70 contracts, and sometimes more. And so it's just a matter of getting it on their schedule. But they are glad to do this for you, to actually bring a framed version of your certificate and present it. So encourage you to do that. Hospitals, invite EMS to your celebration. EMS, invite hospital leadership to your celebration. I think we all know through our work in Mission Lifeline that this is how we work together to create a system of care. So think outside of just your agency or your walls. We talked about some of these. Make sure you have a photographer to document the certificate in your award presentation. And here's just some other ideas in terms of where to present it. We have presented at community events, as I mentioned, galas, and even survivor events. This is a beautiful example. Oops, went away. This is an example of a hospital administrator who is there with the chief and who they're being recognized for Mission Lifeline. And I love seeing it where leaderships in different parts of our organization can come together and promote. Now let's talk about that picture. EMS has the best opportunity and does the best job of having ambulance equipment, et cetera, behind them, but this really makes an attractive photo. And if you were going to send this with a press release, it draws you in a little more than if they were against a blank wall. So I encourage you to look at that. Now, this is something that one of our customers has done for a few years, and it's a traveling celebration. They actually invite leadership to travel floor to floor with treats, and they leave them behind. And then on their little cart, they have balloons, and then they have an award ceremony at every part of the organization. This happens to be stroke that impacts their stroke patient. So we have here, again, their CEO and our American Heart Association Executive Director. We're going from unit to unit, bringing the award, bringing the balloons, and actually getting probably over 100 people recognized by traveling floor to floor. And this is an example of their little cart that has the balloons attached. And this is Deb Motes, our American Heart Association stroke expert, giving them their award, talking about how they've succeeded. So this is actually a pretty time-consuming maybe on the organizer, but it's very efficient, takes a couple of hours, and all the units know that they're coming. If you're in EMS, oops, I just keep moving ahead. Holding the celebration in the city or the county office. Some of the most touching presentations I've been able to give have been at these types of organizations. I remember being in Odessa where the EMS there received a standing ovation from those attending the city council meeting, and it was very, very touching. So make sure that you're doing this and taking advantage of those photo opportunities. Another idea is to have a regional celebration. This happens to be North Texas, where the awards are given to all EMS across the entire region. And so they come together, and AHA is able to help by having the banner there, and they're given their awards along with our Mission Lifeline leadership. And it's just a lot more fun to come together with your colleagues and to receive your awards together. I want to pep up your award photos. I do think that the EMS does the best job of this. Here's an example of how some EMS recognition, how they used a photo to be able to accentuate or to show them getting their award with a part of their equipment and so forth. So always think about peppy pictures. And this is one of my favorite where I was able to we were in LaGrange and able to wait for the air evac to come, and we actually caught the helicopter. They had 10 minutes in between two runs, and we were able to quickly get a photo of the award with their beautiful red, white, and blue helicopter there. All right. Now, again, if you have ideas, pop them in here. We want to hear what you've done that's really worked out that you'll probably do again. All right. If your hospital and your EMS agency are both recognized, come together and promote your awards. This is particularly effective in communities that might have two hospitals and an EMS agency. And if you've all been recognized, what a better way than to come together and show that you're working together for the needs of the community. That's not always the situation. I know sometimes you're wanting to set yourself apart, but if you're all recognized, this is a way to make lemonade out of that. Add a banner on the home page of your website. If you need assistance with this, we can help you. Sometimes your organization may have billboards, and you can have it for a quarter or something to promote your award. We talked about running an ad. On your on-hold message, I don't know how many people hold, but in a hospital there's still quite a few. So you can actually have them add that you were recognized on your hold message. Certainly an ad or article in your external newsletter. And if you have a pharmacy or even a pharmacy partner, have the bags printed with your award on them or put a flyer in the bag during key months. Now don't forget about social media. And I know that, well, I can't speak for all of you, but for me, the social media one has been an area that I've had to learn. And so it's really important. This is where, when you talk about American Heart Association having over 5 million followers, that you can really make a difference. So at the end of your press release, and don't send this, you'll want to delete this off of there before you send it, it actually gives you wording for Twitter, Facebook, and other places that you can put with links that describe your award. So when you only have 288 characters or just a short space, it gives you a link so that they can click and get more. Other examples, putting it on your hospital website. This happens to be an accreditation or certification promotion that Trinity Mother Frances has put on their website. LinkedIn, here's a good example out of Austin, where one of the regional presidents at Seton actually promoted and had a photo of their, took the picture of the PDF that's on your award, and they just put it out through LinkedIn so that they could announce to all of their followers their recognition. Another way to do it is just to snap a photo of that certificate. Amanda Webb at Christus Spawn put this out on LinkedIn last week. I love this, where we're actually getting more of an active picture, and proud to recognize Navicent Health EMS. This isn't somebody in our affiliate, but by the American Heart Association for implementing quality improvement measures for the treatment of patients who experience severe heart attacks, again in LinkedIn. Montgomery County, north of Houston, their recognition for EMS. I love their hashtag, award-winning paramedics. Again, with kind of a super active, artsy picture that doesn't even include the guy's head. Kind of funny, but it gets your attention. And then even from the medical center. And again, people like to see their doctors. They like to see their hospital administrators. And so this is a nice background in one of the treatment rooms or in the cath lab where they are, so that it just peps up the picture a little bit. Again, important to use LinkedIn, and then to get your whole team to be connected on LinkedIn and to share it, so that when one person puts it out, 50 or 100 people share it. So that's the way you have to do that on LinkedIn. An example of how you connect LinkedIn with Facebook. So Sarah here in the Akron Fire Department, again, this isn't a Southwest affiliate, but what she did is take a Facebook post about Mission Lifeline Gold Plus EMS recognition and shared it on LinkedIn. Let me show you the Facebook version of it. There it is on Facebook. So basically, you know, when you share, she shared it over to LinkedIn. So a great opportunity. You're going to get a lot more bang for your buck online than you're going to do in something printed. So make sure that your hospital Facebook is getting this posted on there. And Twitter, surprisingly, and I heard a presentation at the Heart Failure Society of America a couple years ago, that Twitter is a key way that health professionals, especially those in research, are keeping track, because they can look at a particular hashtag and keep track of the work that everyone's doing. So this is an example of how to use Twitter with just a few links to be able to say 6th year in a row, Delaware County's Emergency Medical Center got Mission Lifeline. Combining some pictures. You don't have to have just one picture, but again, showing how you can use Twitter to promote this so it could be retweeted. This is our Williamson County in Texas. Again, I think you saw an earlier award where this was just on June 18th. They received their award. That's Sarah Dzinski, our Director of Quality for that area. and they received their Mission Lifeline Award. A hospital that's promoting their AFib award. And again, this is pretty, it really pops out using their professional photo of their organization with their Get With the Guidelines Achievement Award on top of that out on Twitter. So you certainly, if you work there or that was your hospital, you'd want to retweet that. So attractive. Now, something to think about is to share your actual data. Each of you get each quarter a report from your Director of Quality, or you should, and if you don't, let us know, swaquality@heart.org. But it is important for some of your partners to not only share that you've been recognized, but to share your actual performance. And you can ask your director to assist you in creating an annual update or some performance over time if you want to show them how you've improved in a particular area. But we encourage you to share that with your referring hospital, with your regional advisory councils, with your EMS partners, and EMS, share it with your hospital partners, also with home care agencies and skilled nursing facilities, and all of those who use your services or refer to you. I don't think there's anything more impactful than actually seeing how a hospital or an agency is improving in their care and confirming that that is a good referral source. So work with your Director of Quality and share that data with those partners. And I know that in some cases, we actually have seen folks create posters and share their data with the public as well. And so that is something we can help you depict in a graphical form if you're wanting to promote that to your customers or to your partners. Now, there are some opportunities for national recognition. The silver and gold recipients who had 2018 data, so most of you on the phone, you will be included in a U.S. News and World Report advertisement. It's in the Best Hospitals edition, which usually is dated August 2019, but normally comes out in July. And so you will be listed by state as being recognized. We also will, your CEO in past years has received a letter from Nancy Brown, the CEO of American Heart Association, as well as a few of the inserts. Those are things that you can reprint and give out to your board and give out to funders and perhaps even have in physician offices to show your performance. Also, at International Stroke Conference, and this is always a little awkward because it's in 2020 and that'll still be based on your 2018 data, just the timing doesn't work well with the stroke conference, but we will recognize silver and gold recipients at the International Stroke Conference, as well as before that, scientific sessions in November of 2019. I apologize, those are kind of out of order. At scientific sessions, which is in Philadelphia, mid-November, there may be some recognition, as well as at Q-Core, which is a May conference for American Heart Association. Ask your Director of Quality where your opportunity is to be recognized at those national events. All right, well, I'd like just to take a minute or two. If you have anything that you have done that was really effective, I know that people have things printed, people use lapel pins, we've had all sorts of items where people have promoted their award. Are you willing to type those in our Q&A and let us hear from you what you have done that was successful? And don't hesitate if you want to just tell us *6 and just speak up and tell us what you've done.
We don't currently have any questions in the Q&A section.
If you're shy or you think of it later, we'd love to hear them. So just email them to us at swaquality@heart.org, and we'll actually attach the things that come in because we know some of you have done some things that were clever. I've seen any number of quality cakes and quality desserts that have the recognition on them so that for dining while you're doing your recognition events. I didn't have any pictures of those. If you have some pictures of how you've done it, I've actually seen a banner at a hospital in the Valley that received comprehensive stroke certification and Get With the Guidelines Gold, and actually had a banner that was the whole height of the building. So we've seen a lot of different types of ideas, but we'd love to see your photos. Send them to us, and we'll send them out to the rest of the group. Now, if in case you don't know who your director is, let me just pop you over to that. For some reason, I can't go again. Oh, okay. Take control. And there are all of the folks who do quality for the Southwest affiliate. Sorry, we had to make a colored picture for Texas because it's all divided up in directors. But you have the names here, and these will be sent out to you, so you can kind of identify either by a whole state or by a part of Texas who is your director. And we'd be glad to make sure you have everything you need for your quality award promotion, because we are glad to help you. And Larissa, any final thoughts? It doesn't look like we've got any ideas, but we're hoping you'll send them to us. So give us our final thoughts, and we'll get on with our day today.
Yeah, I'll just give a few reminders. Again, all of the slides that we shared today will be sent to everyone along with the recording in about a week. Also, just remember that any of the materials that are in your marketing kit and marketing link that you received in an email, those materials are templates. They're ready to go. Just make the edits from there. If you do create anything from scratch, make sure that you follow the process to get that approved. I think that's it, Sherry.
Well, we're going to give you a few minutes back, but this is the time. We're so proud of you. We work with you on a regular basis and know how hard it is to actually achieve some of these, and some of you for 6, 7, 8 years in a row. So get out there and share with the world what you've done. Let us come and help you, and have a wonderful summer. Thanks so much.
Thank you, everyone.